Comments from the panel?
Yeah, actually, on those, first of all, the IVUS images are outstanding. I mean, the resolution of that is quite impressive, I have to say. It looks like a very large vessel, which I'm curious as to, with that Aperta balloon, how you go about sizing it, knowing that those are molded cutters, if you will. I know they're not cutters, but whatever those things are called that are molded on the balloon. How do you elect to size that based on the IVUS? Do you have to undersize the balloon? Do you go 1-to-1?
Yeah, so that balloon is an ultra non-compliant balloon, and it can withstand 20 atmospheres. Rated burst pressure is 20. And obviously what you're trying to do is increase pressure at the tip of each of those wedges. These wedges are serving as knife blades, if you would. But the difference is they're not externally affixed, therefore they can't fall off. Therefore they typically cross a little bit easier. And I've been impressed when I've tried this balloon that it goes up. Now, so pressure is, as we said, force per unit area. So you have more force here if you can go up to 20 atmospheres than most standard focal force balloons. Most of those rupture at a much or are not rated up to those levels. But these wedges are fairly short at the tip, so they're triangular, but they're just made of the plastic that's also in the balloon. And I like the fact that it's incorporated. You can't break it off. I would try to 1-to-1 do those, but if you're going to prep for a Supera, you have to be slightly bigger than the Supera, as you well know. If you're not, Supera will come out elongated. There's no real penalty to a stacked Supera that may be shorter than its nominal length, but there's a tremendous penalty to elongation of a Supera. Jay, you look like you're ready to comment.
Yeah, no, I mean, I totally agree. With that kind of recoil, especially when you go outside, you really need to rail it open. I'll rip that vessel, and you might cause a little focal trauma there too, but ultimately you're going to cover it with a stent. I think you're going to be fine. But I will laser these things too, but then I'll even sometimes follow it with some IVL as well too, because you can still, as long as you're close enough to that calcium, you can modify it. But this has some of the highest rates of recoil in that region, and you don't want to have stent regret.